You're listening to 90.8 Hills FM Radio.
This is 90.8 Hills FM radio station, using our voice to rate your choice. Stay tuned.
Hello Nagaland, this is Dr. Priyanka, IVF and fertility specialist from Delhi. Many couples keep trying for months, sometimes years, without understanding what is actually delaying the pregnancy. Most of the times it is not something serious, it is something that simply hasn't been checked. I will be visiting Dimapur to work along with Dr. Alivi, and we are organizing a free fertility consultation camp at Alivi Hospital, Dimapur. The doctor consultation will be completely free, so you can get clarity without pressure. IVF is not always needed. Simple medical or lifestyle factors can make a difference when identified early. To book your appointment, call 93629-58989.
Hello listeners, this is RJ Ayin here, and today I am back with a very interesting episode. Today I have a guest here with me, and apni anjani mugitia guest ane that we will be talking about so many things. Na apni an papi tagiwo aji mugal na guest tu kun ase. And I'm telling you guys from the very beginning, Aji Mugan, this conversation is going to be a very, very important one. So make sure you stay tuned till the very end of our conversation. It's going to be very short, but will be full of information and knowledge. And this is about our health. So this is something you would not want to miss. So make sure you stay tuned. Aji Mugan, we have here with us Dr. Alivi Chishi, Fertility Consultant from Bright IVF. So welcome to our session, doctor. I'm gonna start with the first question. Can you please introduce yourself? I'm sure apni lawas hunishiguli tumwala listeners can already jane pare because this is not your first time here. But can you please introduce yourself and tell us about your work in fertility care?
Firstly, thank you 90.8 Hills FM and RGIN for having me here. I am Dr. Alivi Chishi, Fertility Consultant working at International Pride IVF, where we have tie-up with Olive Christian Hospital Dimapur since 2023. I do consultation and give counseling to those couples who are struggling to conceive.
Okay, so moving on to the next question. Why is it important to talk about fertility openly in our community?
Okay, so it is very important nowadays to talk about infertility as it is increasing rapidly for the last 1 to 2 decades and is affecting both male and female. And I think it is high time to break the social stigma and taboos and work this together. We should make a scientific approach together and accept the proven treatment services.
Okay, thank you for sharing that. And I have something that I'm really, really curious about, and I'm sure listeners can be bishi curious. Many people think that infertility is only a woman's problem. Mm-hmm. So is that true, or can men also face fertility issues?
Okay, so this is absolutely incorrect because infertility is 40% female, 40% male, 10% combined, and 10% unexplained. So you see, it affects both the couple, that is male and the female, equally. Okay. And most important, women are targeted here because they are carrying the baby. But genetic materials are coming from both the partners, that is a male and a female. So yes, both the partners, that is a couple, are equally responsible.
Okay, so listeners, now you know. I am sure dumwekla noy apni an be curious taki with the question though, because mugan most of the time I'm sure poila from our generation of grandmother kan la great taigan bravi, I'm sure female la dehi visual blame gunai taki, but then ityat mugan yate clarify gudishe. So listeners, this is not the only thing, muganaro I have so many questions here for our ma'am muganyadi Dr. Karni. I have so many questions, so make sure you stay till the very end. Now, what are some common causes of fertility problems in men and women today?
Causes in female would be advanced age, PCOS, endometriosis, tubal blockage, uterine fibroids, or hormonal imbalances. For male, it could be abnormal sperm parameter, low sperm count, poor motility or morphology of the sperm, and sometimes complete azoospermia. They are the causes of the infertility in both male and female.
So, how long should a couple try naturally before consulting a fertility doctor?
In a female, if her age is more than 35 and they have been trying for more than 6 months, then they should seek help. For women, once the age starts increasing, the quality and quantity gets compromised along with the time and age. But again, if there are any definite problems like irregular menses, severe dysmenorrhea, or in males like erectile dysfunction or swelling of the scrotum, they should consult immediately.
Okay, thank you so much for sharing that. Aro, apni, both male and in female labi kushi, but apni kitia women ladi kushi ki 35 age to hasi kuna. Because most of the time manungan maiki kan 30s pungji shiguli to mane 30 pungji shiguli to na pare ina gudage na aro rush kuri dage. I have so many, I know so many people also mula sati kan bi ina gudage na friends kan ina se kuna. But then now I know, and I know listeners apni kan bi itu conversation enjoy gudage wo.
Yeah, and one thing here is if the female is married and she's around the age of 30 and she's been trying to conceive, since 1 year and they're not able to conceive, then they should also visit. But likewise, I've mentioned that if the age is elderly at the age of 35 and they're not able to conceive since 6 months, then they should seek help.
Yeah. Okay. Thank you so much for adding that. And moving on, Yati, I have another question. Many people feel scared of fertility treatment. Are these treatments safe? And is age an important factor when it comes to fertility?
According to my experience, patients are usually scared of 3 things. That is the cause. Paisa kiman hobo na treatment karne. Second is the scared of needles or the injections. Repeated visit to hospital because apni infertility check kore se gole follow up bishi important ho jai. Sometimes repeated hospital visit korle bhi lagi jai. And yes, if there would be any side effect of medication, but with proper counseling and modified protocols, we can provide ease and come up with comfortable solutions. So the patient should not be, I request that don't be scared. Everything is advanced now.
Alright, so itya mukanya di member ko na. First thing though, cost la guidage that many people are scared. Cost kimano lao kiki, and she added, but just any movie kan di trailer di no eh. Aji mujin la conversation though. Fertility free fertility camp ekta I will say timoporde. So make sure you stay tuned. Mugan mujin la last conversation di to reveal korle se. So stick around. Now moving on. What role does lifestyle like stress, food habits, smoking, or alcohol play in fertility?
All those above are one of the definite cause of infertility, and especially at this generation, the change of climate, global warming, fast food, inorganic items, bad habits like smoking, drinking, and any usage of intoxicated items or a person living a sedentary lifestyle. So all these are one of the major factor that is also causing the infertility.
Okay, so coming back to the most interesting question, Doctor, please tell our listeners about the free fertility camp in Timopur. When and where will it be held?
We, the International Pride IVF, we often held a free fertility camp once in a month or once in 2 months at Olive Christian Hospital, Dimapur. This time, we have a free consultation on 7th of February, Saturday, 9 a.m. onwards at Olive Christian Hospital, where we will provide the contact number also for the prior appointment booking. Aside the camp, Likewise, I've mentioned in the above that I am always available at Olive Christian Hospital from Monday to Friday. So for those people or the patient that wants to visit me, they can make a prior appointment calling up to the Olive reception or the number that is being provided.
So, who should attend this camp? Is it only for couples or anyone with fertility concerns?
To every couple who are married and are trying to conceive but unable to, and also to the couple who have conceived but unable to conceive again, and to those who had a history of miscarriages or any reproductive health issues. They're all most welcome to attend the camp.
So listeners, apni kan hunina thakiwo Olive Christian Hospital de thakiwole asna to na. So tati address pi dije takan olop takina mukan phone number bi takiwo phone number bi diwo and time to 9 bajira
5 p.m.
5 p.m. tak na. Morning 9 bra 5 p.m. tak kasi on 7th February. So don't forget that. You better note that down. And yate, itiado mugan, we are coming to the end of our conversation. But I still have a few more questions here. So what can the people expect from the camp?
During our free fertility camp, we provide free consultation and counseling and also help in their diet and lifestyle maintenance, which are also, likewise I've mentioned, the causing factor of infertility. So during the camp, we will definitely make sure we always make sure to help and to bring solution for our patients.
In many families, infertility causes emotional stress. What message do you have for couples who feel discouraged?
I can completely understand the emotion they must be going through because I have consulted and the team of International Pride IVF have helped thousands of couples. So during this time of discouragement, family, elders should be the actual role of support, and they should encourage them to go for a scientifically proven treatment. For example, ami kan paisa lakam, beng lakam ekta sukliman beng de jai. We don't just go to any other vendors. If it's anything related work with the bank, with the money, we go there for the investment, right? So likewise the same. If the couples are not able to conceive, they're having infertility issues, instead of being discouraged and sat at home and arom sabi koleni manu khan no shakle elders kan family kan bra thangi discourage, for example aro etu kan huna to doctor ke hi visit kurigena mom bra thangi help kra bhala se. So etu karne, of course, yes, definitely we are not in their shoes. Hollywood conditioner, above all, there is an advanced treatment, and the science have advanced a lot, and the technologies have advanced a lot. So I encourage that all the couples that are discouraged and they're going through a lot of emotions, please come. We are here to help you mend your emotions.
And the best part is that mukaniti 7th of February free camp takiwole ase, fertility camp. So listeners, save the date and time. Itu din do apni kan alakte save kuna rakiwi, and make sure apni ankumba conceive kuli try korisin lito, relating to any fertility la problem kan face kuri ase kuli to apni kan itu din de jaigina free consultant lowly na pauriwi. And we have we only have itiado conversation be end. I have one last question right here. So doctor, what is your final message for our listeners regarding fertility and reproductive health?
To all my people of Nagaland, even in the word impossible, if you break it, there is I am possible. So please don't lose hope. Come out of your comfort zone and help us to help you. Along with the scientifically proven treatment, along with the help of God, let's all work this out in spirit and physical. For the flesh that need life, need breath, and the breath comes from God Himself alone. Dr. Priyanka from Delhi and I will be available for free consultation and counseling on 7th of February, Saturday, 9 a.m. onwards at Olive Christian Hospital. So let's all work this out together. See you all.
So, listeners, that is the end of our conversation. I hope you guys learned something today. Our na 7th of February, which is Saturday, 9 a.m. Brashurogina, 5 p.m. Tak takyule free fertility camp. So make sure you visit address to ase Olive Christian Hospital and Research Center Dimapur. So listeners, that the apni kan jaigna visit korli pargo noli to itu din na agi tv. If you guys have any questions noli to any appointment kan noli to just any questions, any queries, you can contact these numbers. Moi apni an gitya number tuita duo. Make sure to note it down. The first number is 8415 055 995. Moi rek pargo 8415 055 995. Aralak number do ase 8011 751 581. I repeat 8011 751 581. So these are the two numbers where you can contact, and if you guys have any questions, ko anish na mujin la conversation. It's very short. We try to keep it short, but we tried our best. Apni ang information di uli but apni kan mujin la conversation do hunig na apni ang question kumbala answer ko na kulito. You can contact the numbers that we have provided and make sure to visit on 7th of February. Aro mo parkwese Saturday day, Olive Christian Hospital. So thank you so much, Doctor, for sharing this valuable information with our listeners. Aro apni man busy takiliwi apni aji time mo lagi na ije. I'm sure listeners will really, really appreciate it. And this is not your first time here. Second time ase. So next time be ina apni na every once in 1 month or 2 months ina ko na to. Anytime. You are always welcome here, and share your knowledge like to kem kan bob mukan listeners kan ki hutai share kur dagiwi. So yes, thank you so much for having us and for coming here.
Thank you once again. And yes, you're most welcome. And also, I'm hoping to look forward that our team are able to help our people.
Okay, so listeners, with that amazing note, this is RJ signing off from this conversation. Bye bye.